Shoulder flexion and extension. Grasp the patient's arm under the elbow with your lower hand. With the top hand, cross over and grasp the wrist and palm of the patient's hand. Lift the arm to the available range and return. Shoulder abduction and adduction. Use the same hand placement as with flexion, but move the arm out to the side. The elbow may be flexed. Shoulder internal and external rotation. Grasp the hand and the wrist with your index finger between the patient's thumb and index finger. Place your thumb and the rest of your fingers on either side of the patient's wrist, thereby stabilizing the wrist. With the other hand, stabilize the elbow. Rotate the humerus by moving the forearm like a spoke on a wheel. Shoulder horizontal abduction and adduction. Hand placement is the same as with flexion, but turn your body and face the patient's head as you move the patient's arm out to the side, then across the body. Elbow flexion and extension. Hand placement is the same as with shoulder flexion, except the motion occurs at the elbow as it is flexed and extended. Elongation of two-joint biceps brachii muscle. First, pronate the patient's forearm by grasping the wrist and extend the elbow while supporting it. Then, extend the shoulder to the point of tissue resistance in the anterior arm region. At this point, full available lengthening of the two-joint muscle is reached. Elongation of two-joint long head of the triceps brachii muscle. First, fully flex the patient's elbow with one hand on the distal forearm. Then, flex the shoulder by lifting up on the humerus with the other hand under the elbow. Full available range is reached when discomfort is experienced in the posterior arm region. Forearm pronation and supination. Grasp the patient's wrist, supporting the hand with the index finger and placing the thumb and the rest of the fingers on either side of the distal forearm. Stabilize the elbow with the other hand. The motion is a rolling of the radius around the ulna at the distal radius. Wrist flexion and extension, radial and ulnar deviation. For all wrist motions, grasp the patient's hand just distal to the joint with one hand and stabilize the forearm with your other hand. Hand cupping and flattening the arc of the hand at the carpometacarpal and intermetacarpal joints. Face the patient's hand. Place the fingers of both of your hands in the palms of the patient's hand and your thenar eminences on the posterior aspect. Roll the metacarpals palmarward to increase the arc and dorsalward to flatten it. Thumb flexion and extension, thumb abduction and adduction. Depending on the position of the patient, stabilize the forearm and hand on the bed or table or against your body. Move each joint of the patient's hand individually by stabilizing the proximal bone with the index finger and thumb of one hand and moving the distal bone with the index finger and thumb of the other hand. Elongation of flexor and extensor digitorum muscles. First, move the distal interphalangeal joint and stabilize it. Then move the proximal interphalangeal joint. Hold both these joints at the end of their range. Then move the metacarpophalangeal joint to the end of the available range. Stabilize all the finger joints and begin to extend the wrist. When the patient feels discomfort in the forearm, the muscles are fully elongated.